Hey friends, my name is Anna. I'm a team member with SM NCLEX Reviews, and today we are going to continue breaking down big topics and alternate format questions here so you all can practice these strategies and become real deal registered nurses here very, very soon. Today, we are going to be reviewing the NGN style question drag and drop rationale. Now, with the new generation NCLEX, we are seeing a variety of these style questions like drag and drop rationale. As far as these questions go, let's review what they are. Essentially, here with drag and drop rationale, we're looking at what I call a cause and effect, or justifying your first answer with a rationale or the effect. So you're going to drag something into the cause or that first blank. And today in our practice question, that will be the client with the highest priority. Then in the second blank, you're putting the effect or the rationale behind it. So think about it like this. What will happen if something goes untreated? Ask yourself that as we're going through this question. These questions are really testing how you compare information together and critically think through what would happen in real life. Now, let's quickly discuss the scoring of these questions. With this style, it can be a bit complex and it varies by the number of blanks that you are dragging items into. But there are two big things to know regarding scoring. Number one, the lowest possible score on NCLEX questions is a 0, so you won't receive negative points. And number two, to get any questions at all on these, you must have the cause or that first concept, that first blank correct. So we'll do an example in just a second where you need to identify a priority client for our first blank, and you must select that correct client to get any points at all on this question. Now, let's dive into this practice question and see what it looks like. So we're going to meet 4 different clients who all present to the emergency room at the same time. So client A is a 58-year-old reporting a feeling of heaviness in her chest and excessive sweating. Client B is a 34-year-old post-MVA or motor vehicle accident with an injured leg who is bleeding through the current bandage and rating their pain a 6 out of 10. Client C is a 73-year-old with a fever, rapid respiratory rate, and is disoriented to time and place. And client D is a 6-year-old with a muffled voice who appears to be leaning forward and drooling. And then you can see at the bottom of the slide, this is what the drag and drop question looks like. So the registered nurse would prioritize care for blank, and you can see our 4 options above, client A, B, C, and D, due to the risk of blank. And we'll get to those options in just a minute. But first, let's tackle the first blank. Remember, we have to solve the first blank before we can provide any rationale or justification, which is then our second blank. And this question literally uses the word prioritize. So we know this is one of those priority style questions where we want to remember our ABCs. So go ahead, remember your ABCs and apply those to the 4 clients as you answer this. Which client would the nurse prioritize care for? Go ahead and pause this video, and when you're ready, hit play. All right, friends, let's walk through this one. So our correct answer here is client D, a child who is leaning forward, has a muffled voice, and is drooling, is highly suspicious for what? Do you remember? Epiglottitis. And if you all remember what epiglottitis is, it's when the epiglottis literally swells and can block the airway. And remember your mnemonic we mentioned with prioritization questions? A, B, C. Airway, breathing, and circulation. Epiglottitis is a medical emergency, so if the nurse suspects this, it is absolutely a top priority to assess. The position that this client is in can also clue us in that there may be something going on with their airway or breathing, and that leaning forward can also be called the tripod position. All right, let's look at the other answers here. With client A, definitely a distracting answer here as we may be concerned about a myocardial infarction when we hear words like chest pain, chest heaviness, diaphoresis, or excessive sweating. But is that an airway, a breathing, or a circulation concern? Circulation. And we know airway comes first. Then client B, bleeding from an injury. Again, this is a circulation concern. And client C may have a type of infection. Remember that older clients with infections may have confusion. So yes, all of these clients need something, and it needs to be addressed. But client D, the child with suspected epiglottitis, needs to be seen first and is our top priority here. All right, let's look at this again. So we have our first blank, which is going to be client D. Now let's look at the rest of it. So the registered nurse would prioritize care for client D first due to the risk of blank. And here are your options. So you're going to look at these options and you're going to go ahead and drag one of these, or just pretend to at home, into that blank. Pause the video and press play when you're ready. Well, if you were paying attention, you got this one right. We would prioritize care for client D due to the risk of airway obstruction with epiglottitis. Again, all of these clients have pressing concerns, and at first, I know these can feel a little overwhelming. But when we really look at our ABCs, it can be as easy as 1, 2, 3. Thank you all for joining me today. Make sure you hit subscribe so you don't miss our weekly videos as we continue to break down the different NGN questions and provide you with that much needed content for your NCLEX. Also, be sure you join our free Facebook community and follow us on Instagram and TikTok as we post daily content there as well. Remember, my friends, you can absolutely do this, and we are rooting for you.